Welcome to the part 2 of the cardiovascular system module. In this part of the lecture, we will trace the main blood vessels in the body. Our tracing begins with the aorta. Remember that the blood from the left ventricle will be pumped out of the heart via the aorta to reach the systemic circulation. The aorta is divided into three major parts: the ascending aorta, the aortic arc, and the descending aorta. Let us discuss the branches in each part of the aorta in the next slides. The ascending aorta is the initial part of the aorta. Imagine this is the ascending aorta arising from the left ventricle after the aortic valve. Just above the aortic valve are the aortic sinuses. These are pockets between the aortic valve's cusps and the vessel wall. The right and left coronary arteries arise from these sinuses. The coronary arteries are encircling the base of the heart like a crown. These are the first branch of the aorta, and these are the blood supply of the heart itself. The right coronary artery originates from the right aortic sinus, coursing cranially under the right auricle, then to the right coronary groove. On contrary, the left coronary artery arises from the left aortic sinus, coursing to the left under the left auricle and immediately branching into descending or the paraconal and encircling or the circumflex branches. The paraconal interventricular branch is the descending branch of the left coronary artery at the paraconal interventricular groove. The circumflex interventricular branch is the branch of the left coronary artery coursing in the coronary groove from the left side of the heart, while the subsinosal interventricular branch is the descending branch of the right coronary artery at the subsinosal interventricular groove. Now we move to the aortic arc. As you notice, the aortic arc is a direct continuation of the ascending aorta. This vessel sends branches to the head, neck, and the thoracic limb. The first branch of the aortic arc is the brachiocephalic trunk, and the next is the left subclavian artery. The brachiocephalic trunk gives rise to the common carotid artery. The left common carotid artery and the right common carotid artery ascend to the neck and supplying the head, face, and the brain. The brachiocephalic trunk also gives rise to the right subclavian artery. Both the right and left subclavian artery supply the neck, thoracic limb, and the cranial portion of the thoracic wall. Finally, we have the descending aorta. This is the part of the aorta caudal to the aortic arc. It can be divided into a thoracic aorta and abdominal aorta by the diaphragm. Here you can see the continuation of the descending aorta at the thoracic region. The thoracic aorta is the division in the thoracic cavity. It supplies the thoracic wall via the dorsal intercostal arteries. After the diaphragm, it will become the abdominal aorta. Here is the abdominal aorta supplying the organs of the abdomen. Now let us identify the branches supplying the specific parts of the body. Let us begin with those arterial systems supplying the head. To orient you, let us locate the aortic arc. Here is the aortic arc. As we recall, the brachiocephalic trunk gives rise to the common carotid artery and the right subclavian artery. Remember, the left subclavian artery is a direct branch of the aortic arc. The common carotid arteries are the main branch supplying the head. Here is a schematic illustration of the head of a dog showing the different vasculature. Here is the common carotid artery. The common carotid arteries, both from the left and the right, will then give rise to the internal carotid artery and the external carotid artery. The internal carotid artery will supply the brain, while the external carotid artery will supply the face. The maxillary artery is a direct continuation of the external carotid artery below the orbit. Its branches supply the orbit, teeth, chin, nose, nasal cavity, and the palate. The internal carotid artery then enters the cranial cavity, joining the basilar artery to form the circle of Willis. The circle of Willis, or the arterial circle, is located ventral to the hypothalamus, encircling the infundibular stalk. It is formed by the paired internal carotid artery and the basilar artery. The basilar artery arises from the vertebral artery and the ventral spinal artery. The arrangement of the brain's arteries into a circle of Willis is believed to create redundancy for collateral circulation in the cerebral circulation itself. If one part of the circle becomes blocked or narrowed, the blood flow from the other blood vessels can often preserve the cerebral perfusion well enough to avoid the symptoms of ischemia. We will not go in detail with the structures or vessels completing the arterial circle at our level, but at least you have an idea regarding the role of the internal carotid artery in the brain. After the arterial system, now let us briefly discuss the venous system of the head. In contrast to the arterial system, which supplies their respective organs, the venous system drains the blood from their respective organ. The maxillary and the linguofacial vein join to form the external jugular vein. The external jugular vein and the subclavian veins join to form the brachiocephalic vein. The brachiocephalic vein join to form the cranial vena cava. The arterial system of the thoracic limb arises from the subclavian arteries. Remember, the right subclavian artery is a branch of the brachiocephalic trunk, while the left subclavian artery is a direct branch of the aortic arc. They supply the left and right thoracic limb. The axillary artery is a direct continuation of the subclavian artery around the first rib to the thoracic limb. It supplies the structures of the shoulder and continues as the brachial artery after the subscapular artery branches off. Subscapular artery passes between the subscapular and the teres major muscles. Brachial artery is a direct continuation of the axillary artery on the medial aspect of the arm which it supplies. It continues as the medial artery after giving off to the common interosseous artery. The common interosseous artery is located at the interosseous space between the radius and the ulna. The median artery is a continuation of the brachial artery. It supplies the forearm. The digital arteries are the blood vessels of the metacarpus and the digits. The venous system, on the other hand, is divided into superficial and deep veins of the thoracic limb. Deep veins travel with like-named arteries. Superficial veins travel usually by themselves just beneath the skin. The superficial veins are normally the site of blood collection or venipuncture. Among the superficial veins is the accessory cephalic vein. It arises from the dorsal digital vein. It travels to empty as the cephalic vein. The cephalic vein, on the other hand, arises from the palmar digital veins. Proximal to the carpus, it crosses the medial side of the forearm to reach the cranial surface. It is joined by the accessory cephalic vein before continuing up the cranial surface of the forearm and lateral surface of the arm under the brachiocephalic muscle. It empties to the external jugular vein. This is the most common vein used in collecting blood. Now let us discuss the vasculature of the abdomen. Remember, the descending aorta moves down to the abdomen, bypassing the diaphragm, becoming the abdominal aorta. Its main branches are the unpaired celiac artery, cranial and caudal mesenteric arteries, and the paired renal and gonadal arteries. It terminates into two internal iliac arteries and an unpaired median sacral artery. For visualization, let us locate them using this figure depicting the branches of the abdominal aorta. The celiac artery supplies the stomach, part of the duodenum, the liver, and the spleen. It has three main branches: the left gastric artery, the hepatic artery, and the splenic artery. The cranial mesenteric artery supplies most of the intestine, while the caudal mesenteric artery supplies the descending colon and the rectum. The paired renal arteries originate caudal to the cranial mesenteric artery and supplies the pair of kidneys. The gonadal arteries, or the testicular or the ovarian arteries, depending on the sex of the animal, are small vessels supplying the gonads. They usually arise just caudal to the renal arteries. The common iliac artery further subdivides into an internal and external iliac artery. The internal iliac arteries supply the pelvic viscera and part of the hip and the thigh, while the external iliac arteries supply solely the pelvic limb. The median sacral artery is an unpaired artery of the tail. Its caudal continuation is called the caudal artery. For the venous system, the paired branches travel with the arteries of like name. For example, renal artery has a counterpart renal vein. They empty directly to the caudal vena cava. Those draining areas supplied by the unpaired branches of the aorta do not return to the caudal vena cava, but join to form the portal vein. The caudal vena cava is formed by joining of the right and left common iliac veins, while the portal vein is formed by the joining of the cranial and caudal mesenteric veins. It receives the gastroduodenal and the splenic veins as well. The portal vein drains into the liver, allowing intestinal blood to be processed and cleaned. The arterial system of the pelvic limb is derived from some branches of the internal iliac artery and mostly from the external iliac arteries. The internal iliac artery terminates into caudal gluteal and internal pudendal arteries. The caudal gluteal artery leaves the pelvic cavity to supply the gluteal and the proximal part of the caudal thigh or the hamstring muscles. The cranial gluteal artery arises from the caudal gluteal artery to supply the middle gluteal muscle. The external iliac artery penetrates the abdominal wall through the femoral canal to become the femoral artery. The femoral artery is a direct continuation of the external iliac artery, coursing in the femoral triangle on the proximo-medial side of the thigh. It continues as the popliteal artery caudal to the stifle joint. The popliteal artery is a continuation of the femoral artery behind the stifle between the two heads of the gastrocnemius. It branches into cranial and caudal tibial arteries. The saphenous artery arises from the femoral artery in the femoral triangle. Cranial tibial artery is the larger branch of the popliteal artery arising in the interosseous space. The dorsal pedal artery is a direct continuation of the cranial tibial artery over the tarsus. Metatarsal and digital arteries are similar to the metacarpal and digital arteries of the forelimb. For the venous system, deep veins parallel to the arteries are of the same name. Superficial veins occur via the medial and lateral saphenous veins that do not parallel in a similarly named arteries. The medial saphenous vein passes on the medial side of the limb with the saphenous artery. It empties into the femoral vein and the apex of the femoral triangle. The lateral saphenous vein travels on the lateral side of the limb to enter the caudal popliteal region and empty into the distal caudal femoral vein. This can be used for venipuncture in dog when the cephalic vein is unavailable. And that concludes our discussion on the cardiovascular system. Take note that we only tackle most of the common blood vessels. The key to understand the branching is to trace the vessels and identify the main organ they are supplying or draining. It takes time to recognize all the blood vessels, but the idea is to at least give you an overview of the overall arterial and venous system in the body.